Today I'm going to talk about why did I start a GLP-1 medication, or why did I need a GLP-1 medication if I had gastric bypass. But first, hi, if you're new here, my name is Ana Leonora. I had gastric bypass surgery in July of 2023, started GLP-1 medications in June of 2024. Altogether, I am down over 180 pounds from my highest weight, and I'm taking whomever wants to come along for the journey with me. So if you're interested in following along, make sure you hit your like and subscribe button. I am also on TikTok and Instagram at The Bypass Babe. So, why would I need to take a GLP-1 medication if I had gastric bypass? I'm so glad you asked. Gastric bypass and weight loss surgery in general, only 5% of people who have weight loss surgery will lose 100% of their excess weight. Only 5%. Meaning 95% of people who have weight loss surgery will not lose 100% of their excess weight with surgery alone. Also, people who have gastric bypass typically lose 70 to 80% of their excess weight. People who have gastric sleeve tend to lose 50 to 60, maybe 70% of their excess weight. I had 200 to 220 pounds of excess weight to lose. I'm currently down just over 180 pounds, so I still have a little ways to go, but I'm getting there. I knew going into surgery that there was a chance that surgery alone was not going to remove all of my excess weight. There was a 95% chance I was not going to be in that 5% of people who lose 100% of their excess weight from the surgery alone. I knew that, but I needed to get weight off of me. So I knew at the time surgery was the best option for me. Also, statistically speaking, I'm a nurse, and I really like to look at the statistics, the science, the evidence, the numbers, right? Statistically speaking, most people who have weight loss surgery will lose the majority of the weight that they're going to lose within the first year post-op. Do some people continue losing weight after the first year? Absolutely yes. But the majority of people who have weight loss surgery will lose most of what they're going to lose in the first year post-op. 11 months post-op came around, I was down 135 pounds. That is a successful weight loss surgery in my opinion. 135 pounds is a massive amount of weight to get off of me. I was no longer on the 2 blood pressure medications I had been taking. I was no longer on the daily heartburn medications I was taking. I was doing a lot better, feeling a lot better. But at 135 pounds down, I did still have a good amount of weight to lose, right? To get to that 200 to 220 pounds down. Also, what the surgery provided for me was a medically induced portion control. It makes it so that I cannot eat too much, right? That's what the surgery did. It took my stomach from a normal size to the size of about an egg or a golf ball. That's what the surgery did for me. What it did not do was address my underlying hormonal and endocrine disorders. I have Hashimoto's thyroiditis, which is an autoimmune thyroid condition, and I have PCOS. Both of these conditions are not curable. They are treatable. There are treatments for them, but they're not curable. And both of them traditionally lead to ease in gaining weight, difficulty in losing weight, hormone endocrine imbalances in the body. The surgery did not fix that. It gave me the portion control. However, they're finding with the GLP-1 medications that they're actually, again, not a cure for, but they're a very good treatment for PCOS and thyroid conditions to help with that hormone and endocrine balance. So at 11 months post-op, when I saw my doctor, I asked if I could go on the GLP-1s, and they said yes. I've now been on GLP-1 medication for 6 months, and I've lost an additional 50 plus pounds, or about 50 pounds, 45 to 50 pounds in the last 6 months, putting me much closer to my overall goal than I was at a year post-op. If I could go back in time, would I not do surgery and just try GLP-1? No, because my obesity was complex and multifaceted and required a complex and multifaceted approach to try to treat it, right? The GLP-1s absolutely do help with portion control, and they do help remove food noise, but they're not as effective portion control as surgery. So having had the surgery first and having lost a bunch of weight and worked on my relationship with food, my portion sizes, what I'm eating, doing therapy and all of that, and taking care of that first, and then introducing the GLP-1s that's helping with my hormone and endocrine disorders, for me was the right order, the right way to do things. It's been very successful for me thus far. I am enjoying it. I'm glad that I did it the way that I did it. Is everyone who has weight loss surgery going to need a GLP-1? No, absolutely not. Is everyone who takes a GLP-1 going to need surgery? No. No. Everybody's journey is different. You have to do what works best for you, listening to your medical team, listening to your body, and understanding that, for me, obesity has been a lifelong battle. I started noticing I was bigger than the other kids at just 8 years old. I am now 33 for context. So I've been obese pretty much my entire life. And again, my obesity was multifaceted. Was I overeating? Yes. But I also have these hormone and endocrine disorders that are never going to go away. So I treated my obesity in a multifaceted approach. It has worked for me. And yeah, I encourage anybody who is looking into either the surgery or the medications just to do all the research and try to have really realistic ideas of what the outcomes are and can be. Because again, there's a lot of people who go into weight loss surgery thinking, absolutely, this is going to have me remove 100% of my excess weight. And then when it doesn't, they're super disappointed in themselves and think there's something wrong with them. But again, the studies show only 5% of people who have weight loss surgery will lose 100% of their excess weight. So I knew that going into the surgery. And again, I do think the 135 pounds lost in my first year post-op was successful. And I am happy with that. But I also knew that I needed something else. I needed another tool in my toolbox to help me battle my disease of obesity. And so I introduced the GLP-1s, and it's working very well for me. So I hope that makes sense. And let me know if you guys have any questions.